What is the wave of the future in radiography, you might ask? It is the Philips cassetteless system. No longer are radiologic technologists tied to cassettes, walking back and forth endlessly to change them. Here at Cottage, we employ only the latest and the greatest. Unfortunately, we do not use cones. So, for the rest of my trigger presentation, I will not be using cassettes or cones. Anyways, sit back, relax, enjoy this sweet, futuristic robot unicorn wallpaper that I downloaded from the internet, and enjoy my skull trigger presentation. Hi, I'm Benjamin, and I'm going to be doing a sinus series, and I'm going to start by I have cleaned the wall bucky, and I have detented CR to 40 inches, and it's centered to the bucky. Anyways, I'm going to go get my patient, and we'll get started. Hello, sir. I'm Benjamin. I'll be taking your x-rays today. Can I get your full name and date of birth?
Yeah, Pablo Salas, 2/16/88.
Okay. And is there any, if you were a lady, is there any chance that you're pregnant?
Nope.
Okay, good. So today what we're going to be doing is we'll be taking 4 pictures. The first picture, you're going to just, 2 of the pictures, you're going to be with your face up against the board. And then the last one, you're going to have to bend back like that. And this is all just to look, to see if you have any sinus infections.
Okay.
So have you been having swelling or sinus problems?
Yeah.
How long?
About a week or so.
Okay. Alright, so I'm going to get y'all started. Okay, so now I'll be demonstrating my lateral sinus. I'm going to be using 85 kVp at 5 Mass. Mr. Salas, for this first one, I'm going to put this lead shield on you. We're going to put it on the back, because for all these you'll be mostly facing. Go ahead and wrap that around. Okay, so the first projection that we're going to do is the lateral. So I'm going to have you get a 45-degree angle to the board. That's good. Your body's like that. And I'm going to raise this up. And I'd like you to take a little tiny step toward this way. No, too much. Go back. I'm gonna just touch your head to move you around, okay? So, chin down. So I've got my patient in true lateral position. So I'm going to swivel this around and turn it on. And I'm going to cone down just to get the pertinent information, and I'm going to mark it with a right, because it is his right side that is facing the board. Alright, Mr. Salas, I'm going to ask you to hold still, hold your breath, shooting x-ray, alright, you can relax, sir. Alright, so that was my lateral sinus, and I'll be moving on to the PA Caldwell sinus. I'm going to be doing this at 85 kVp at 10 Mass. I have tilted my bucky forward 15 degrees, and now I'm going to have my patient step up to the bucky And go ahead and place your forehead and your nose. And this board's going to move up a little bit. Okay, so I want him to be so that the central ray is going to exit the nasion. Okay, so go ahead and have your forehead and your nose up against the board. You are centered. Okay, that's centered. And I'm going to collimate down, so I'm not getting the entire mandible or the top of the skull. I can actually collimate a little bit more, and that's good. So my central ray is perpendicular, exiting the nasion, and 15-degree tilt on my bucky. Anatomically, that is his left side. Okay, so hold your breath, Mr. Salas. Shooting X-ray. Beep. Okay, we're all done with that one. That was the Caldwell sinus. Okay, and now I'm going to demonstrate the water sinus, also known as the parieto-canthal projection. We'll be using 85 kVp at 12 mass. And first of all, I'm going to readjust my bucky so that it is straight up and down. Okay, too far down. And I'm going to center my central ray so that it is exiting the canthion. So, sir, what I'm going to have you do is step up to the board. I want you to lift up your chin, touch your chin to the board. Okay, lift up your. I'm going to move your chin just a little bit. Okay, that's good. Move up my board a little bit. So that central ray is going to be exiting the canthion. Make sure his head isn't tilted. Line up my CR with my bucky. Throw my marker on there. Collimate down. And notice that the MML is perpendicular to the IR, and the IOML is forming a 37-degree angle with the IR. Okay, hold still, Mr. Salas. Shooting X-ray. Boop. All right, you can relax. And that was the water sinus. Now I'll be demonstrating the SMV sinus. I'm going to use 85 kVp at 12 mass. And my patient is young enough to stand and do this position. So, sir, I'm going to have you step this way a little bit. Come forward. And I want you to tilt your head all the way back and touch it up against that plate. There you go. That's perfect. Can I have you take a little tiny step that way? There we go. Alrighty. My central ray is going to be entering midway between the gonian and about 2 inches below the mandibular symphysis. That's good. Just get it right there like that. Collimate down. Mark anatomically. This is his left. So hold still, hold your breath, shooting X-ray, beep. Alright, you can relax, sir. And that was the sinus SMV.